Okay, we're joined by Dr. Dayna Long, and you have an article in the September 2013 issue of Contemporary Pediatrics called A Disruptive Innovation, in which you talk about the FIND system, which is the Family Information Navigation Desk, that has really helped you help people who are, I'll just say, financially challenged in society. And our question, if you could elaborate, please, on how can community pediatricians implement something like FIND, excuse me, in their local communities. They're not research hospitals, they're teaching hospitals. How can the pediatrician in the trenches implement something like this?
So I'm a pediatrician at Children's Hospital Oakland. We're a freestanding children's hospital, and we are also a safety net. We are a federally qualified health site, which means that the majority of our patients are receiving Medi-Cal, which is in California our version of Medicaid. And so the majority of our patients are living underneath the poverty level. And we know that social determinants of health, health inequities, health disparities, they contribute in such a large part to our children coming for asthma, our children coming in for ear infections, our children coming in to the medical home with all of these social and environmental factors that are contributing to their health. So the Family Navigation Desk, the goal is to help address systematically social determinants of health within the medical home. So what we do is for every patient that comes in, we screen them for social determinants of health. Do you have enough food? Do you have stable housing? Are you signed up for the benefits that you should be receiving, whether that's WIC or SNAP or any other kind of disability or SSI? If families have positive screens for these social determinants of health, they will get flagged and sent to our FIND desk. So FIND stands for the Family Information and Navigation Desk. That is staffed both by parent navigators as well as college students from the community. The goal is that we want to be able to connect our families with community resources when they come to the medical home. So let's say, for instance, a family comes in saying, this happened yesterday, saying that they just got evicted from their home and they need some emergency shelter. We'll be able to refer them to our desk, which will then be able to help the family at that time sit down and call resources to find emergency housing. If they say they don't have enough food, we'll be able to type in their zip code into a database and connect them with the local food bank. If they don't have access to fresh fruits and vegetables, we'll be able to give them a list of farmers markets in the area that take food stamps. So we are connecting families to community resources when they come into the medical home. And we know that as physicians, we need to see patients. This allows us to help address these issues routinely when they come for their clinic appointments, but not actually in the exam room, so that we can work at the top of our license and yet still get all of these needs addressed.
So this seems like it's a very collaborative effort with other members of the community. How much of the system or program is electronic, or how much of it can actually be started without having expensive electronic devices?
So for our pilot, we started out just using an Excel spreadsheet. The big dream is that we can really gather our efforts and ask for the tech companies to help us build a very large database that has multiple functions that community members as well as pediatricians and navigators can constantly modify and input data. That's the dream, that's the goal. But you can start with paper. you can start using Excel spreadsheets. It doesn't have to be high tech, and we are working collaboratively with the other institutions within our region. And so there's an adult county hospital as well as the county hospital that's next door to us. We've formed a Bay Area regional collaborative so that we are recruiting and training these volunteers together, so that we together identify needs, and by working together we can more effectively positively address population health as a group.
That sounds, you said a key word, and that was volunteer. I think if we're talking about tips that the pediatrician in the trenches, so to speak, could use, making use of local college students to help recruit community members.
So our navigators are coming from both community colleges as well as University of California, Berkeley. There are a lot of students that for this is a huge experience for them. They're being able to work in a hospital with social workers and physicians, and for those that want to go on to other health fields, whether it's being nurse practitioners or going to medical school, this is life-changing because they're working with families to help them get their basic needs.
Well, you said life-changing. It's also clearly life-changing for a lot of your patients, and also for how you as a physician can practice medicine really more holistically, as you said, not just in the exam room, but allowing the time you have in the exam room to be synergistic. Is there anything that you would like to add?
So the notion of family navigation, to me, it's how we should be working with our families. We need to do so much more than just write prescriptions to refill asthma medicines or to treat sinus infections. If we want to help prevent asthma, then we need to deal with the mold that's in the home. We need to make sure that if kids are going to be successful in school, that they actually have access to breakfast every day. That we need to, as pediatricians, treat not just the medical issues, but all of the social and environmental issues in a much more routine and systematic way.
Dr. Long, thank you so much for spending time with us and elaborating on this important issue. It'll be very interesting to see how it develops.
Thank you.
Thank you.